Otitis media, or middle ear infections, are common in children, especially those between the ages of 6 months and 2 years. Hi, I'm Dr. Beth, and I'm a pediatrician at SickKids. Let's talk about ear infections and 5 important things for you to know that can help you care for your child when they're sick. Otitis media is another term for an infection of the middle ear, the space behind the eardrum. It can be caused by bacteria or viruses, and often occurs following an upper respiratory tract infection such as a cold. When your child has an upper respiratory tract infection, mucus and swollen tissues can block the eustachian tubes. The eustachian tubes connect the ears to the back of the throat, helping to ventilate and drain the middle ear. When there is a blockage in the eustachian tube, the middle ear does not get ventilated. This leads to changes in air pressure and possible pain, similar to what happens in an airplane during takeoff or landing. Fluid builds up in the ear and traps any viruses or bacteria that are already there. The fluid buildup can become infected and put pressure on the eardrum, which makes it bulge. This can be very painful. When a child develops an ear infection, they may experience several symptoms, including fever, earache, pulling or rubbing the ear, crying, difficulty sleeping, and fluid draining from the ear. Here are 5 important things for you to know about ear infections. 1. Diagnosis. Your child's healthcare provider will need to examine them for a proper diagnosis. This includes checking for fluid in the ear and any changes in the eardrum. They may also examine your child's neck and throat for swollen lymph nodes. 2. Eardrum perforation. In some cases, the pressure in the ear can lead to a small hole or perforation in the eardrum. This can result in yellow fluid draining from the ear. Typically, the hole heals within about a week. However, repeated ear infections and perforations can potentially lead to scarring and long-term hearing problems. 3. Treatment and when to seek care. Many ear infections will often resolve on their own, but it is important to make sure your child is comfortable and that their pain and fever are controlled while waiting for the infection to resolve. You can give your child acetaminophen or ibuprofen to ease their symptoms. Your child's healthcare provider may prescribe antibiotics if the infection is severe, your child has significant pain or high fever, or their eardrum has perforated. 4. Activities. Ear infections do not pass from one person to another. Your child can go back to daycare, school, and their regular activities when their fever is gone and they feel better. When your child has an ear infection, they can still go outside and do not need to have their ears covered. If their eardrum has perforated, then your child should avoid swimming or getting water in their ears until it has healed. 5. Prevention. Remember that viral upper respiratory tract infections, including colds, can lead to an ear infection. To reduce the spread of viruses, the most important thing you can do is practice good hand hygiene. Wash your hands and your child's hands frequently, especially after coughing, sneezing, wiping their nose, or coming into contact with someone who has a cold. Also, if possible, reduce your child's exposure to anyone with symptoms of a virus and make sure your child is up to date with their vaccinations. Vaccinations such as the flu shot, the updated COVID-19 vaccine, and the pneumococcal vaccine all offer protection against upper respiratory tract infections and ear infections. When to consult a healthcare provider. If your child's fever or pain is not better after 48 hours, children with an ear infection who do not improve on their own are often prescribed antibiotics at that time. If your child has already started on antibiotics for an ear infection and is not improved after 48 hours of treatment, if fluid is draining from their ear, if your child develops redness or swelling behind the ear or the ear seems to stick out. I hope you found this video helpful. Subscribe and visit aboutkidshealth.ca for more. Thanks for watching. Stay healthy, everyone.